The preventable and highly contagious disease, measles, is making a comeback in the U.S. due to vaccine skepticism. That is according to the CDC. Today, both New Jersey and Kentucky are reporting new measles cases. That's in addition to California, New York, Alaska, Georgia, and New Mexico, who have already reported cases, with the most cases, over 100, in rural West Texas, which this week claimed the life of a school-aged unvaccinated child, marking the first U.S. death from the disease since 2015. So to help us understand more, let's bring in our medical expert, Dr. Payal Kohli, to discuss. Dr. Kohli, thank you so much for being here. First and foremost, what is measles?
Sam, measles is a very highly contagious respiratory virus, and it's one of those infections that you definitely don't want to get because it has severe complications. In fact, 20% of people who are unvaccinated who contract measles will end up in the hospital, and 3 out of 1,000 people will actually die from the infection.
So, Dr. Kohli, if this is a preventable disease with vaccination, why do you believe that some parents are choosing to not vaccinate their children against it?
You know, it is a highly preventable disease. In fact, 1 dose of the vaccine covers you about 93%, 2 doses is 97%. So we thought we had gotten ahead of the disease. And more recently, this phenomenon of vaccine skepticism has really allowed it to sort of wake up again. And as a physician, I've personally never seen a case of measles or treated a case of measles because it had been eradicated here in the US. But what we're seeing is that our herd immunity, which was at 95% vaccination, has started to slip in the past few years because parents are afraid that vaccines might be linked to autism because there's misinformation out there. Following the COVID pandemic, there's all these questions about how safe are vaccines, and that has unfortunately created the situation that we're seeing today.
Yeah, a lot of people are debating science if you go online. And listen, you brought up misinformation, and I think it's important to note that, you know, with RFK Jr. in charge of the Department of Health and Human Services, considering his history of vaccine skepticism, linking vaccines to autism, which has been debunked, are you concerned that there will be more outbreaks of preventable diseases in the near future?
I am terrified of this, and I'm terrified of the fact that we're going to have outbreaks of diseases that we as physicians don't know how to treat because we thought we had eliminated them. Diseases like polio, for example, because we have very effective vaccines. And to your point, there has been no scientific link to vaccines and autism. So that really is misinformation. And I think with, you know, people like RFK in charge, the public trust is eroding in the physicians and the scientific system. There is that propagation of misinformation, but I'm worried that this could even impact public policy, because if we start to make vaccines optional for people, even the people who don't mistrust the vaccines may think that they don't need to get them, and that may actually cause these diseases to grow. And the impact won't just be in the United States, it'll really be global.
So, Dr. Kohli, once a child or an adult gets sick with measles, is it too late at that point to vaccinate? Are vaccinated people at risk?
So it is too late at that point. Once you get the infection, you can't get the vaccine because it's already gone inside you. In fact, the vaccine is a live attenuated or weakened version of the vaccine. So you really want to get it ahead of time so that your immune system knows how to fight the infection. Now, if you're a vaccinated adult, I said the efficacy of the vaccine is 97%, which means it's not 100. The good news is your immunity is likely to last for most of your life for most adults. Only about 1%, you know, it wanes over time. But the more infection we have around us, the less effective the vaccine is. So even as a fully vaccinated adult at 97%, that's not 100. And in fact, in Texas, we have seen some vaccinated people as well who contracted the measles infection. Now, because it's a live vaccine, not everyone can get it. Immunocompromised people can't get it. Pregnant women can't get it. So it really behooves those of us who can get it to get it so that we can really stop the spread of the infection.
Right, that's how herd immunity works. And, you know, if you were to tell, as a physician, if there's any viewer out there, a parent who is hesitant in vaccinating their child, whether it be measles or another preventable disease, you brought up polio, what would you tell them?
I would tell them, do not turn your back on science. Science has always been our guiding light, and do not let, you know, random people on the internet or questions that are not based in science let you, you know, not vaccinate your child and protect them, because that death that happened in Texas is a preventable death. And the American Academy of Pediatrics actually issued a statement that no child should be dying of measles in 2025. Now, children under the age of 12 months may not be able to get vaccinated because they're too young, but you can actually vaccinate children as young as 6 months during an outbreak. So please empower your child, protect them, and do the right thing for science, because not doing so can really lead to deadly outcomes and preventable deaths.
Dr. Kohli, thank you so much for your insight. We know how busy you are, so thanks for making time for us today. Thank you, Dr. Kohli.